Hi, everyone. This is Eddie Mitchell for the CRM 751 Conflict and Resolution and Negotiation Group Project Part 2, the Integrative Negotiation. In our group, again, is Darius Ford, myself, Kathleen Perry, George Ausler, and Carrie Clark, and we look forward to discussing our scenario with you. For this second group project, after discussion, our group selected Scenario 2. Scenario 2 involves Dr. Sato, who's opened a fairly new clinic, private practice called Clinic 2, and she's seeing a steady increase in the patient volume. She's also involved in clinical research studies, but really hasn't implemented a good strategy to recruit patients. Her private practice is steadily increasing with the patient volumes, and she's struggling with the balance between the clinical research study and the daily operations. She does believe in this study, but she's having an issue with balancing the need to prioritize her patients over the study research. So the clinical research manager has been focusing on a cross-sectional study to determine the prevalence of chronic knee pain following total knee replacement up to 5 years post-op. This clinic is struggling with the proper data collection and form completion. So our focus question from our group is, did the knee replacement alleviate chronic pain after 5 years post-op?
So Dr. Sato's case is a really interesting scenario. And in order to address some of her issues that she's having at her site, we want to look at a strategy for our meeting when looking to deploy and start up their trial. So we'll use integrative bargaining or integrative negotiations as the negotiation strategy. And this is where we share the power and the outcome, and we want to achieve a preferred solution for both teams. So both parties will make a commitment and honor what is agreed upon. So most people would refer to this as a win-win situation. So below you'll see a few steps that Kathleen and George will go into a little bit later, but here you'll want to present the issues and plan to execute the negotiation strategy. So how will you present and frame the issues and interests, determine how you will structure and process the information, and set goals that are specific, achievable, and relevant. So the 10 steps that we found for implementing the negotiating strategies are as follows. You want to define the negotiation goals, make sure that they are tangible or intangible or procedural. Define the major issues related to achieving that goal. Assemble the issues, which is organizing them, rank them from importance, and define bargaining mixes. Define the interests of both parties. Know your alternatives if the negotiation strategies fall through. Know your limits and resistance points, and this is also true for the other team as well. So from below, you'll see analyze and understand the other party's goals, issues, and resistance points. And set targets and opening bids. Make sure that you have targets, goals, and places set in line within that conversation to ensure you can successfully facilitate that conversation. You'll also want to assess the social context of the negotiations and finally present those issues to the other party when you go into that negotiation meeting. So a quick rundown here. Once we are at the stage of ready to plan for that negotiation meeting, you would want to consider face-to-face negotiations, especially in clinical research. Although the pandemic has limited us with that sort of contact, typically you would want to have these types of conversations face-to-face to ensure that both teams are comfortable and make sure that there's a safe space as well to have this conversation. You would want to create an agenda and allow times for the teams to review beforehand. So again, this is really what we've learned throughout the semester, and a part of being a good clinical research manager and a leader is to ensure that the meetings that you're facilitating are well organized and structured with a clear plan, topics, and someone to take minutes. So consider how long the teams need to meet. This is a pretty typical standard, and this is something that we would want to do in this situation with Dr. Sato, especially with sites where their time is pooled and very limited. You would want to make sure that the time is used and productive. You also want to consider those alternatives if the negotiations fall through. So have some sort of a response system if the negotiations turn bad, which we don't want to happen. But if you do, you want to have those in place. And then finally, you would want someone there to take meeting minutes or have the meeting recorded. So this is always good because you would be able to look at all of the issues that were surfaced and take away some of those action items so we can effectively implement the negotiation strategy and come up to solutions for both sides.
Game theory is a framework of understanding situational choices that can be made by others, particularly helpful in negotiation when examining potential outcomes and finding cooperative solutions. When considering negotiation, goals, strategies, and styles must be taken into account. And in order to have a mutually beneficial outcome, all parties must not only consider their position, but that of the other. Goals should be realistic, attainable, specific, measurable, and relationship-oriented. Strategies should be integrative and adaptive. And a style in this case that we'll be using is collaborative. The 4 steps to integrative negotiation include identifying and defining the problem, considering surface interests and needs, generating alternative solutions, and evaluating and selecting acceptable alternatives. Dr. Sato's clinic is fairly new, small, and is unaccustomed to clinical research. While this PI would like to participate in orthopedic research, this site is struggling with recruitment and data collection. Ultimately, the PI is prioritizing resources for daily operations over research. As CRM, we need to convince Dr. Sato that this research could identify and address her patients' needs in the long term, but she would need to utilize and share her current resources in the short term to meet requirements of our agreement. When considering the issues at this site, it's possible our study may be the only research study being conducted, and so although slowly accruing, we could take advantage of this time to effectively train site staff, monitor data, and offer support. If goals are met as CRM, we could also bolster recruitment efforts by supplying patient-directed materials and media and network with affiliated physical therapy or rehabilitation offices as examples. This site may need more clinical research educational support and training compared to larger, more experienced sites. Furthermore, having designated clinical site staff to assist with research, instruments, and data collection may be worthwhile to ensure quality and integrity of data and research processes.
Step 2. Surface the interest and the needs. Why does the physician and the site research staff want what they want? Well, it's evident that there's an interest to participate in clinical research to assist in advancing medical care in this field of medicine, but also to increase the volume of patients at a newly formed clinical practice. What are the potential interests at stake if things do not go according to plan? Well, from the perspective of the clinical research manager, they may lose the opportunity to show that this device is superior based on evidence collected in this research study. From the perspective of the physicians, they may lose the ability to show that this device does improve mobility with less chronic pain, ultimately leading to a better outcome for their patients. And that may negatively impact the draw of future patients to their newly formed clinical practice. But what are the mutual gains of the physician and staff for the study? Well, there's an intrinsic value of participating in advancing in clinical research, but also getting better outcomes for patients and being able to share that evidence with their patients who've had total knee replacements. And lastly, it may negatively impact their practice and influence their future profits. Therefore, it's important for everyone to be successful together. Step 3. Generate alternative solutions. What can be done for the physicians and the site research staff to work together better? Is there ways to utilize resources in a more efficient manner? Increase the number of participants for the study through recruitment plans or strategies? Can we incorporate technology and maybe interchange locations, combine data? An example would be, is there the possibility of widening the inclusion criteria of this particular study without compromising the study design to improve recruitment of study participants? Also, how do we have more effective cross-cultural teams? Can the CRM train, coordinate with both sites so that there's adequate data collection, documentation, and staff to collect the data? Also, Can the investigator measure the outcome and exposure in subjects at the same time? Take a collectivism approach, members responsible for the entire group. Can the experienced physicians help the new physicians with clinical research? And also understanding the differences, being empathetic, transparent, communicate, have joint decision-making and conflict resolution among the team. Step 4, evaluate and select alternatives. What's the BATNA, or Best Alternatives Negotiation Agreement? Is there a good backup plan or second option in the event that things do not get better? Should the trial be outsourced? Will the physician ever see the CRM's vision with the clinical research trial? Even with all the improvements, will this trial be able to recruit candidates to conduct the study? Both parties need to be comfortable with the agreement and may need to alter the agreement later, although the physician may still find that the study is too demanding even with having a CRM.
The best solutions on how both parties can mutually gain are: create a win-win situation. Both parties can mutually gain by understanding the other party's perspective and identify factors that contribute to achieving shared goals. Use strategy to gain an understanding of the parties' needs and wants. Joint problem solve. Discuss issues. Compromise so both parties get what they want. Ask open-ended questions and actively listen. Mutual gains require planning and understanding interests and having alternatives. Create value with value distribution and follow-through. Once the agreement is made for both parties, they must honor their agreement, effectively communicate, and build on the relationship to achieve goals and address issues as they arise. The outcome is to advance the research study, increase patients at the clinic, have a successful clinical practice, train the staff and the physician, and have a good support staff to bring in future studies. So in conclusion, develop alternative measures for both parties to gain. Share information and use integrative tactics for negotiation to create a win-win situation. This strengthens the relationship and it helps to achieve goals and objectives. Using integrative negotiation establishes collaboration to work through issues and to maintain positivity, gaining insight to what both parties need, want, and it promotes the achievement of goals. Clinical research manager has the resources to recruit participants, while the physician collects data to determine if the knee device is better than the standard. This will increase patient flow, and with experience, this physician can continue with clinical research studies to promote her clinic and increase her business. Thank you so much for watching.